Hello everyone. My name is Michelle Bonnici, and I'm the Interim President and CEO for the Good Samaritan Society, Good Samaritan Canada, and Good Samaritan Delta View Care Centre. I know that the past months have not been easy for any of our residents, their loved ones, or our employees. In the past few weeks, our organization has had to deal with the reality of COVID-19 outbreaks at a few of our locations. Thankfully, 2 of those outbreaks have now been declared over by public health, and we are currently focused on the one at our Good Samaritan Southgate Care Centre in Edmonton, Alberta. Our number 1 priority continues to be the health and well-being of the residents at the care home and our employees. We're working closely with Public Health and Alberta Health Services on this, and they have a team on site to provide support and assist us with the testing of residents and employees. While we currently do not know how exactly the virus entered the building, outbreak protocols continue to be in place, and we are taking all precautions to limit its spread. This includes retesting all asymptomatic residents, restricting resident movement throughout the home, and employees wearing appropriate personal protective equipment. Enhanced cleaning protocols are in place that follow the public health orders and includes the cleaning and disinfection of high-touch surfaces 3 times a day and low-touch areas daily. Outdoor visits have been cancelled, and we are following the Chief Medical Officer of Health's orders regarding essential visitors. Employees and residents are also screened twice a day, including temperature checks. The screening tool we use for both residents and employees is comprehensive and covers all of the requirements listed in the public health orders. These are just some of the ways we're keeping those we care for and our employees safe. Our employees and residents are doing as well as can be expected during this difficult time. The dedication and resilience that our employees show each and every day truly makes them healthcare heroes. I know that many of our Southgate Care Centre family members have questions, and I want to ensure that we are providing you with those answers. I'd like you to know that our employees are doing everything they can to keep you informed. Please remember that their first priority is to actively provide care to the residents. Our Southgate Care Centre is a large site with over 200 residents that live at the care home, and our employees are doing their best to provide timely responses to your questions. To ensure we're providing you with the information you need, I'll address some of the frequently asked questions we have been receiving in this video. To start, many of you want to know what our current case numbers are. As this information is rapidly changing, we've decided to keep the information up to date on our website, gss.org. At the time of recording this video, 12:30 p.m. on Friday, July 17th, we have 34 active resident cases and 9 active employee cases. We have 1 recovered resident and 4 recovered employees. It is with a heavy heart that I can confirm we have had 2 residents pass away who were positive for COVID-19. On behalf of the entire organization, I want to extend our deepest condolences to their families and friends during this difficult time. Our caregivers and residents are a tight-knit community, so I know our Good Samaritan family is grieving too. As cases have increased, some people have asked why our numbers are going up so fast, and the number of cases reported is increasing as we become aware of results that includes the testing of all residents, even if they're not showing symptoms. As you may know, a person can have COVID-19 and not show any symptoms, which is why we have been testing all residents, including those individuals who are considered asymptomatic. In fact, we've actually undertaken this testing twice in the last month in order to ensure that we're aware of any cases, whether someone's showing signs of the illness or not. As you know, the nature of this virus is that it is very contagious, which is why we're following the public health orders and doing everything we can to limit the spread further. The next question is whether or not we're isolating unwell residents, and the answer to that is yes. Residents who are unwell or who have tested positive for COVID-19 are being isolated and placed on precautions. This means that employees are wearing full PPE when providing care. All protocols are in place to limit the spread of the virus and to keep healthy residents and our employees safe. And speaking of PPE, another question we've received is whether or not we have enough of it. And the short answer to that is yes. We're working closely with our vendors and Alberta Health Services to ensure that our PPE supply at all of our care homes is sufficient. Levels are monitored daily, and currently we have enough stock to meet our employees' needs. The next question we've received is whether or not we've done any additional training with our employees. And I can tell you that we have both an education and an infection prevention and control team that has been offering guidance and education on a variety of matters since the beginning of the pandemic to all of our care homes. For example, they're ensuring that employees know how to put on and take off PPE properly, as well as how to wear it correctly and in what situations. Another area of focus is ensuring that employees know how to complete proper hand hygiene. Our teams are regularly providing education at the care home and revisit different topics as necessary. And all of our education meets the continuing care health service standards, which stipulate what we need to educate employees on and how often. These are just some of the questions we've been getting, and I know that you probably have many others. For that reason, I'm going to do another video like this next week and would ask you to please submit any questions you would like answered. While this is targeted to our Southgate care home, I of course welcome any questions other people across the organization may have. Please send in your questions by the end of day on Monday, July 20th to goodsaminfo@gss.org, or you can call 780-431-3748. I am committed to getting you the answers you need. To conclude, I'd like to thank all of our residents and families for your continued patience and understanding, and for your willingness to work with us through this unprecedented situation. I can assure you that our #1 priority continues to be the health and well-being of our residents and employees. We will continue to provide updates to you. Please stay safe, God bless, and thank you.